So today is the day before my operation. Tomorrow morning I'll be going in at my mission time is 8 o'clock. I can have dinner tonight, which is good. So I'm going in for a full knee replacement. Now, I'm quite young for a knee replacement, but I have had previously four knee operations, and there's not much more they can do with it apart from replacing the knee. I'll just show you how my knee looks now. You might be able to see there's a couple of scars from previous operation. I don't know if you can see compared to the other one. It's probably not really, but the left one is always slightly swollen compared to my right knee. Yeah, so we'll see how it goes. Um, been waiting a while to get it done. Yeah, so today's the day. We're about to head off. Got my night bag. Hopefully it's just going to be a day surgery and I can get out today. Otherwise, might be overnight, so we'll check in afterwards. So I've had my operation. I'm now just recovering. I don't know, it all went well. My knee is quite achy, which is natural. And they provided me some food. So, a pot of water and ham and cheese sandwich. Just be nice to have some food in my belly. Yeah, so. Alright, just updating you on the timeline where we're at now. Yesterday I had the operation around about 10:30 in the morning. Woke up around about 3 o'clock. I was a bit foggy for let's say half an hour, and then my brain, the fogginess seemed to clear, which was really good. My wife came around, Lizzie and Brosnan, the son came around, give me some company for a few hours. Had a lovely dinner around about, I think, 6 o'clock, 5:36, and then they left to go home. Now the time is 5 o'clock in the morning the next day. And I have not had a wink of sleep the whole time. I've been wide awake, which hasn't been too bad. I just haven't felt like going to sleep at all. Watching TV on my phone, listening to some Audible. Drinking a lot of water because my throat's quite dry. Otherwise, I'm feeling good. The pain has fluctuated. At the moment, it's pretty good, which I'm happy. They've also just brought in the ice machine down there, and they just set that up for, I think, around 6 o'clock, where I get my next dose of meds, and then they'll put the ice machine on to help with the swelling. So, yeah, honestly, I thought I'd get some sleep, but none at all, and I don't feel like I've been awake all night. So yeah, I'll check in later on and see how we're going. Yeah. So what's the time now? About 6 o'clock, is it? So we're at 6 o'clock. It's the day after the operation. All went well. Only thing is that I did not get any sleep at all the whole night. I did, in saying that, about 5:30 I managed to doze off for about 10 minutes, but I was just wide awake the whole night. One of the more irritating things, the pain was pretty good through the night with the medication they gave me. The thing that I struggled with is that I got the hiccups quite badly, probably about 5 times through the night. I think the worst I had was an hour of hiccups, which I didn't expect to happen. So, 6 o'clock now, the day after. I'm pretty tired. Had a 2-hour nap this afternoon, which was good. They got me walking around. There is movement. They got lovely socks, and obviously bandage on there. So that's the kind of wound. So you can see it's quite swollen in comparison to my other leg. But yeah, the surgeon was happy how everything went. They measured the movement. I could kind of bend it to about 82 degrees that way, and virtually straight. When I do that, even when I'm walking, very, very tight in there. So I think the main thing is they want me to walk as much as I can. But first night, hopefully I better get some sleep tonight, which will be really good. Yeah, and then we'll just check in tomorrow and see how we go. So we're at the end of day 2. Time is 7:20 p.m. Had an interesting day today. At least last night I slept really well, which was good. I didn't have a lot of issues with pain, so it was nice to be able to get a good night's sleep. And did a little bit of walking around as much as I can on the crutches. Try not to stay in bed for too long or sit for too long. I'm trying to get some movement on my leg. We went down to the mall today. I know it's only day 2, but good thing about the mall, they had a wheelchair, so my lovely wife pushed me around in the wheelchair, which is good because there's no way I would have coped going around in my crutches for an hour. There's just no way with the pain. So the crutches were the wheelchair was really good. And then we came home. I was pretty tired after that. Chilled out for a little bit, and then had dinner and watched the watched the All Blacks get beaten quite badly by South Africa. So it wasn't good for us. Good for the South Africans, but not for us Kiwis. But I almost didn't do this video tonight because for the last hour I had a massive bout of the hiccups, and it was really bad, and it was continuous for at least an hour, and there was nothing I could do to get rid of it, and I didn't honestly think that it was gonna stop. So it could be a side effect from the medication that they're giving me. If it continues tomorrow, then I may have to see the doctor and see why it is causing me to hiccup, and it's really bad. It's actually it's worn me out completely, and only literally stopped. I managed to stop it 10 minutes ago. Aside from the hiccups, everything else is going well. Obviously still quite tender, and the ice packs, we've got an ice machine which we've been using, but they also from the hospital gave me an ice pack. I'll see if I'll just get it for a sec. So this here, as you can see, this goes in the freezer. It's got Velcro on it, and then it attaches to this. Hopefully you can see clearly enough. That just attaches there, and then goes on my knee. I do have the bandage on there, so it's not on my skin. And to be honest, I find this much better than the actual machine that they gave me. So I think I'll be using that from now on. And I feel like I'm going to hiccup again. No. So I think that's been the hardest thing today, is the hiccups. So hopefully it doesn't continue. But aside from that, yeah, all is well. Hopefully get another good night's sleep tomorrow, and then I'll check in again tomorrow night and yeah, see how we go. Okay, so we're here at the end of day 3 post-op of a full knee replacement on my left knee. Good things. Last night I slept really well. Slept all the way through, no issue with pain. Woke up about 6 o'clock, I think it was, in the morning, feeling really good. So that's quite a surprise. I mentioned, I think, yesterday that I've had 4 knee operations prior to this one, and the ACL operations that I had a full brace on, strapped in there for 6 weeks before it could be taken off, before I could have any movement. So it's quite foreign for me to be 3 days into after the surgery where I can actually bend my knee to, I'd say, probably 90%, and I'm sleeping it quite straight, and even just walking around at the crutches, I'm getting quite a lot of movement. So I know everyone's experience is different, age, severity, in regards to the type of operation that's needed, but I'm kind of shocked that that I don't have a lot of pain and the movement has been really good. Obviously the medication they've given me makes me feel a bit drowsy at times and a bit weary. Also good news is that I have not had any fits of hiccups today, which was good, because yesterday, even after my video, I had another bout for probably half an hour of quite intense hiccuping, which was quite concerning. But today that's gone, which is really good. So yeah, all in all, I am feeling good. We returned the ice machine that we were giving to help with the cooling and the icing, because the ice pack strap that they gave me, I find was much better. I could strap it around, put the ice on there, pump it up, it'll make it nice and tight, but also give me the coolness that I need, and also flexibility to move around. So yeah, end of day 3, so far so good. Tomorrow morning, which will be, today's Sunday, tomorrow morning will be Monday morning, we've got the first appointment with the physio. So I haven't talked to anyone since the operation, so I don't know if I'm doing good, if I'm doing bad, or what's happening with the knee. I'm actually happy with how things are going. I feel things are going well, so it'll be interesting to see what the physio has to say tomorrow. Also, it'd be good to know what sort of exercises that I can do. I know it's only 3 days, so I probably won't be doing too much, but I'm happy with the process is going and how things are going so far. So yeah, all is good, and I'll check in with you tomorrow. So we're on day 4 after the operation. Had the operation on Thursday. Today is Monday. Woke up with a little bit of a pain in my leg this morning. Just took some pain relief for that. Otherwise, I had a pretty good sleep. Got a phone call from the nurse just to follow up to see how things were going. That was all good. Everything seems to be fine. Also, tomorrow I have an appointment booked in with the physio, so it'd be good to see the physio tomorrow, see what they say, see what their thoughts are in regards to where I'm at, and also I know some exercises that I need to be doing. So I think they're going to be visiting once a week for 5 weeks, and then see how we go from there. The hardest thing that I find is not doing anything. and being okay with not doing anything. So just learn to, it's okay to do nothing, it's okay to take it easy, it's okay to um, stop, which I find difficult to do, and I know Lizzie is the same. We're kind of active relaxers, you could say. Um, yeah, but in regards to how everything's going, I'm really happy with my movement and how I'm getting around. Also, one thing to make life easier is they give you so much medication that every time I go to do the medication, I have to sort out exactly, lunch or dinner or morning meds. So I brought one of these, and then I just sort it out every day what I need to do, so I don't have to think about it. I can just go to either Monday morning, noon, or evening, and then just get the meds that I'm required to take. Just make things just as simple as possible. So yeah, really good. Look, it was a big decision, obviously, to get a knee replacement, especially only being 49. My specialist said that a year ago that it all depends on how long I can handle the pain with my knee the way it was. He said, I could last 5 years, but it was completely up to me if I wanted to get it done. I made the decision that, um, 25 years from now, is 5 years, waiting around 5 years going to make a big difference or not? And I suppose when you're making a big decision like this to get a full knee replacement at such a young age, you've got to weigh up all your options and find out what's best for you. I wasn't anxious or nervous about it. I made the decision and decided to go with it, and I'm glad that I have. I suppose, ask me 20 years from now if it was the right choice or not. We'll see. But I'm quite happy with the choice that I made, and hopefully my recovery goes well. I'm quite pleased with how things are at the moment, even though it's only 4 days. So, I mean, you can't really say much in 4 days. Um, Good evening. Well, end of day 5 today. This morning was a real doozy of a morning. Woke up at 5:30 in quite a lot of pain. The worst pain I've been in so far. So naturally just took some medication, tried to push through the pain, try to find a comfortable spot, try to go back to sleep, which I kind of did off and on for a little bit, but the pain was quite intense this morning. So it wasn't really a good start, and then it was about 8:30. I just overheated. It was quite stuffy in the caravan. I needed to get out, get some fresh air. So I got up. Lizzie was great. Got me some breakfast. I came outside. It was warm but fresh, which was nice. Nice little breeze. My heart rate just increased intensely. But I managed to, after cooling down with the ice pack and having some breakfast, in about 10 minutes my heart rate dropped down, and I started to sort of calm down a little bit. It was kind of like I had a fever, but it wasn't. So it was quite intense this morning. So it wasn't a great start for the day. It took a while to sort of recover from that, just tired and weary. But aside from that, the rest of the day has been pretty good. I went down to the swimming pool, chilled out there. I did not swim, of course, but I just went down there and hung out and watched them as they went for a swim. And then I had the physio this afternoon, and so that was good to see the physio, to see how I'm going, what to expect, because I don't know what to expect 5 days after a knee replacement. I have no idea. But he was happy of how the progress was going with my knee, but also just encouraging me to continue to move it more regular, If I need to take the pain medication, especially for the first 2 weeks, then take what I need for the first 2 weeks at least anyway. And but then we went for a walk with the crutches, and he encouraged me to put more pressure on it, to put more support. He said the knee is strong enough to handle that. So all I need to do is just have a bit more confidence of that and use the crutches more as balance instead of full support. So it was good to be able to do that, to go for a bit of a walk and put a little bit more pressure on it, and just get more confidence in my knee, which was good. So yeah, end of day 5, it was nice to at least talk to the physio. I'll see him again in a week, and progress through there. Obviously it's just pain management, trying to keep it moving, not being it too stiff, or not moving it for too long periods, because afterwards it can be quite hard to move my leg. But aside from that, all is going well. So yeah, we'll check in tomorrow, would be Wednesday, so it'll be day 6 afterwards, and then yeah, I can't see there being too much change, but I'm not looking forward to the mornings. But the physio did say that if I take some pain medication and then try to get some movement and circulation through my leg, that will definitely help. So I know, we'll see how that goes in the morning, and I'll talk to you tomorrow. So we're at the end of day 6. So just on pretty much a week now. Just another day. Basically managing pain as much as I can. Tonight I'll show you a little bit more of how the leg actually looks. Hopefully the light is bright enough where you can actually see the difference, and you'll be able to see kind of where the stitching and the scarring is. So if that kind of puts you off a little bit, then maybe fast forward a little bit. So let's just have a look here. So hopefully with the lighting you can kind of see that's the knee. There's a scar there, and then you've got the main scar coming up, and then obviously an incision there as well. If you can compare both knees, obviously you can see it is quite swollen in comparison. Same as my feet. My left foot is quite swollen, which of course you expect that. Yeah, so movement, let's see if I can, as you saw, I can kind of get in and out of the caravan without the crutches. I generally still use the crutches for more balancing than anything. Movement still very stiff, which is expected. As I say, it's only like 6 days. I'll turn this around so you can have a look. So I'll just move that here, hopefully you can kind of see. Then I'll move that down a little bit more. So movement so far, it's not, probably say that's probably as far as I can go. If I push it maybe a little bit more, and if I straighten it out, you can kind of see not too bad. Obviously the longer that I either laying on bed or for a longer period of time, the stiffer it is. So I always have to try and remember to get up, move around, even though it's stiff and tight, to try and get some movement going in my knee and in my leg. So yeah, so I'm actually quite happy how things going. I can put quite a bit of support and strength on my knee. So I'll just move around this way now. Yeah, as I say, there's not really much more that I can say. I'm happy with the movement. Actually, I might stand up and see. So the lighting's probably not the best, but I can kind of bend it very, very tight. But in regards to standing and whatnot, I can kind of support my own weight, okay, which is good. So yeah, in the meantime, it's just been patient, going through the healing process, and yeah, just taking things easy from there. And actually feeling it now, it feels really hot. Obviously the more I move it, the more it heats up. So I've had a nice pack on it 4 times today. I'll probably do tonight's about 8 o'clock, I think. So I'll go back, put the bandage back on. I just took it off to show you, and yeah, just put some ice on it tonight, and then hopefully get a good night's sleep. Now, last night when I slept, I decided to put a couple of pillows on the bed, and then lay on my back, and then just have my leg elevated. And I found that in the morning I didn't have the pain the same as the other night that I had. So that is good. Yes, I suppose I'm happy with the progress so far after a week. Yeah, and then we'll just see progression. The next video, I will show just I suppose how I'm walking. Hopefully I'll notice a bit more difference in how easy I'm finding it to bend a little bit more, and a little bit more strengthening in that as well. And we'll just see how we go from there. Yeah, so 6 days in, not doing too bad. Alright, check in later.